which we have with Shanghai Chest Hospital. The Shanghai Chest Hospital is the largest lung cancer treatment institution in China. And in addition, one or maybe the largest center of excellence for minimally invasive and robotic surgery in the world. This is quickly said, but when you hear the numbers, you might be quite impressed. Last year, they have seen 10,000 new lung cancer patients in this hospital. And they have performed 8,000 resections in lung cancer patients. When I visited them in the OR, they performed 30 lobectomies in a day. And if you know the numbers in Zürich, what is required for a center that they are allowed to do this resection, this is about the yearly number. And Professor Luo has started the program with the Da Vinci robot a little bit less than 3 years ago, and since then he has done over 700 cases, and just last year 348 lobectomies with the Da Vinci robot. So it is a busy program. So how do we have this outstanding collaboration with Shanghai? How has this started? In 2003, Professor Luo visited us here in Zurich for a couple of months. Initially, it was very difficult to communicate because he had quite limited English knowledge, but took lessons. And over the time, I realized more and more that he comes from an important place. And at that time, he saw for the first time a VETS lobectomy. A minimal invasive lobectomy and other procedures, of course, and now he is the world leader. Now we go back and learn from him. The year after, Qiang Tan came to see us, a very eager research fellow. We started a program in tissue engineering, and he was full of ideas. And frankly speaking, I learned also a lot of different approaches from Chinese doctors to science than we are doing. And Qiang Tan was very active. He collaborated with different people. But one distinct difference I learned from his approach to science is that he was changing all parameters all the time. And I tried to explain and say, no, here in our thinking, we do a study, and then we change one parameter, we go back and look what it happens. And after a long time of discussion, I suddenly realized that in their thinking, which is probably even as good, is that when you change one parameter, everything has a different interaction. So don't believe just by changing one parameter, all the same, interact the same. So it was a different, interesting discussion. He moved forward and he received a grant from the SNF on tissue engineering of a trachea. And 2 years later, we even received a Sino-Swiss program, for a Sino-Swiss program, money from the Chinese government and the Swiss government to start such a project, in addition to build up a minimal invasive surgery center in Shanghai. The same year I was invited to be a visiting professor there. It was outstanding what they did. And then in one of their large lung cancer meetings, we had a Sino-Swiss lung cancer forum. In 2011, we had a highlight because it got a joint statement between the Bundesrat and the Minister of Science and Technology on technology collaboration, and we were the second project on the 5 lists listed there. And ever since whenever the Bundesrat goes to China or one of the Chinese doctors is coming, I get a request, how is our collaboration doing? And so when they signed this collaboration, on the first page, the second project was ours in this red booklet. And then we continued, we had further meetings together, and our initial project on tissue engineering, Kiang Tan continued and performed it clinically, and he will report on this. And as I said, now we go back, and Isabel Opitz was there in the OR to learn from this from this outstanding experience. We have publications together. There's another one just coming out now on the tissue engineering trachea, and you can see here in one of the last meetings, it is the Chinese-Switzerland International Lung Cancer Forum, and we had even the TV there, and I had to give an interview there. So I come now to introduce the first speaker. The first speaker is Professor Lu.